Oh, brief, please. Let's hear. Manifestation as well as post-manifestation. It can lead to what are the what are the different types of adverse effects that we can have after immunization? Pain, yes. Sorry. Increase in temperature, how do we call it? Sorry. Paralysia, beautiful. What again? What can we have? Inflammation. Pain, death. Death. Or loss of vital function. Disability. Sorry. Yes. So all of these are. One thing you should know is that anything can happen. An adverse event of any nature can occur after the introduction of a xenobiotics or any drug in the body, because the pharmaceutical company can never know all the adverse effects that will occur, because humans are so genetically diverse. That is why whenever you look at the medication insert, that is the writing inside the medication packet, they always say that some adverse effect may occur which has not been documented yet. Is it okay? But serious adverse effects are those that lead to disruption of vital processes in the body, like respiration. You can have cardiorespiratory depression, unconsciousness, disability, and death. Those are serious adverse reactions. And it's alleged that it happens a lot in COVID. It's alleged that many people died after receiving the vaccine. You heard that, right? I don't think there's a justification. I don't know. Maybe there is. I'm not aware of any justification because I'm not against the vaccine. Okay, beautiful. I already answered this question. Question number 8.
The type of immunity transfer in breast milk for mothers
read.
Natural active immunity.
What is active immunity? Listen. You know, basically, immunity can be active or passive. When we talk about active immunity, what are we saying? This is an immunity that is triggered after the entry of a pathogen in the body. The immune response that is put in place when a pathogen enters the body is referred to as an active immunity. It means that immunoglobulins like immunoglobulin G and M are only produced in response to an infection, maybe Staphylococcus aureus. Are we there? But if you have immunity that is not put in place due to exposition to an infectious agent, it is passive. And passive immunity do not always stay for long. They don't have a memory. There is a big difference between these two. This one doesn't have a memory. It simply means that the immunoglobulin G that a child can have through breast milk, for example, will not stay in plasma in the form of a memory B cell. But the moment a child becomes exposed to Staphylococcus aureus, there is a production of plasma cells that can keep a memory to fight a future infection. That explains the reason why I was saying that it is very imperative for continuous breastfeeding, because this passive immunity dies away, it fades away quickly, there is no memory. But this one always has a memory and lasts longer. So the immune system is just like a way that the body tries to fight invaders. But there are situations in which, in trying to fight an invader, the body overreacts. You know, they say excess of disease, right? So if in trying to eliminate a microorganism, the body overreacts, it leads to what we call hypersensitivity reaction. You heard this right? Good. So hypersensitivity reaction refers to an exaggerated immune response that the body puts in place in order to eliminate the microorganism. Hypersensitivity reaction means that maybe an allergen or a pollen, some people are allergic to pollen, something that will normally not cause a disease, when it gets into the body mounts an immune response. So it means in hypersensitivity reaction, the body is unable to differentiate between disease-causing microorganisms and things that are not disease-causing microorganisms. And these reactions are classified according to type 1 to type 4. We won't go into details of that. But type 1 is always called allergic reactions. That's what people always say, I'm allergic to this. I'm allergic to penicillins. So let me go separate for this and all that. So the immune system, you should always look at this like look at it like the armies. The Cameroonian army is there to protect you from an invader. But if in protecting you from an invader, their response is in such a way that they instead attack you, it can lead to what we call autoimmune disease. Because the immune system is made in such a way that it knows the cells of your body from any other cell. But if you reach a situation where the cells of your body cannot be recognized by the immune system, or they are looked at as foreign bodies, the immune system will instantly start fighting the cells of your body, destroying them. That's what we call autoimmunity. In that case, we say that the mechanism of tolerance has failed. An example of a disease that's an autoimmune disease is type 1 diabetes. Because in type 1 diabetes, the immune system destroys the beta cells of the islet of Langerhans so that insulin cannot be produced anymore. Many diseases, rheumatoid arthritis, lupus erythematosus, the Hashimoto's thyroiditis, all of these diseases, they are linked to a situation where the immune system that was supposed to protect you has turned against you and is instead fighting you. So basically, immunity is active or passive. It can be hypersensitive in nature if there is an exaggerated response. Normally, if the immune cells cannot know the cells of the body from foreign cells, it leads to autoimmune disease. There are many of them. Is it okay? Have you done immunology as a course? Do you do immunology as a course? Sorry? MLS. I think, let's see. Details of that. So what you obtain from a breast milk is natural passive, and it dies with time because the body receives ready-made antibodies from the mother. Next question.
Question 9. Primary health care is essential, accessible, available, acceptable, and appropriate health care given to the people involving their full participation.
That is just the definition of primary health care according to WHO. That's the standard definition. There are some characteristics that primary health care must have. It must be essential. It must be accessible. That is by a majority of the people. It shouldn't be an affair of the rich alone. Because the life of the rich as well as the life of the poor man is equally important. So accessibility means economics exigencies. It should be available. Healthcare should not only be in Yaoundé. If you go to my village, you should be able to find it. Even in your own village, you should be able to have it. According to the WHO's definition, it should be acceptable. It should be something that the population do not see as a threat to their survival. And it should involve everybody's participation. So this is the definition of primary health care according to the WHO. This is the standard definition. I don't think it's something to talk about. Who's here? Good.
Healthcare is practiced or organized in Cameroon in the following levels, except
Good. Strategic level is referred to as the central level. What we have in Cameroon, you must have seen this, right? The healthcare in Cameroon, we have the pyramidal structure. It's organized in the form of a pyramid. What you have here up is the central level or a strategic level. At the level of the central level up here, what you have the Ministry of Public Health, which is the organ that is in charge of every health activity in Cameroon. You have category 1 hospitals, which are hospitals like CHU, our hospital, the general hospital, the gyneco, obstetric and pediatric hospitals. Those are category 1 hospitals. Then at the intermediate level here, you can have category 2 hospitals, that may be district hospitals, regional hospitals, and the others. Then you can have now the periphery. This one is called the intermediate level. So the organization of the health structure in Cameroon follows a pyramidal model from top to bottom. So as you are moving from the central level to the peripheral level, the number of health services or the services increase in number. Central, intermediate, peripheral. So you have the strategic, which is correct, the intermediate is correct, and you have the peripheral, which is what we call the operational. At the level of the peripheral here, you have hospitals like integrated hospitals, district hospitals. Then at the intermediate, you have regional hospitals and central hospitals. It's important for you to know. At the central, you have Ministry of Public Health, you have these regional hospitals, central hospitals. And I'm saying that central, we begin here, the ministry is here. Say Ashu is here. Ash Gupi is here. You know Ash Gupi, right? Ash Gupi in Musu. General Hospital is here. Krase is here. So these category 1 hospitals are hospitals whereby the director is always appointed by the President of the Republic. If you have some specialized services, like where I'm working is here. Comité National de Lutte contre le Sida, we are here. Comité National de Lutte contre la Tuberculose, it is here. Comité National de Lutte contre le Paludisme, it is here. So those specialized services, all of them are at the central level. That's why you can only find them in the capital of the Republic. We now live here. You know l'hôpital central, right? L'hôpital central is here. The director of the health services of this level are always appointed by the Minister of Public Health. District hospitals, regional hospitals, and the central hospitals, and maybe even the delegation, regional delegation. Every regional is here. Then when you go here, this is the operational level. We have smaller health services. The clinics that we have all over, they are the peripheral levels. And when it comes to public clinics here now, the director can be appointed by the regional delegate of public health. That's how the Cameroon health structure is scheduled. That's how it's structured. So you should know the difference between l'hôpital central and l'hôpital general and the Bamenda regional hospital, where they can call here because they can give something like this. The regional hospital Bamenda is here. even the annex in Campbell is here. Then the district hospital, for example, where I'm from, is here. District hospitals, integrated hospitals. Those are the cardiac center. Good. This organization takes into place the hospitals of the states. But if you look at the cardiac center in Shishon, it should be here. It's not the operational because we look at the services they offer. The nature of how advanced the service is okay. So the Shishon Cardiac Center, even in Queen Baptist Hospital, all of them should be at this intermediate level here. But you cannot be here. The ones that are those category 1 hospitals that I've spoken to you about. And most often as a nurse, when you are recruited or as a medical doctor, when you are recruited in a public service, most often you can either start exercising here or here. You can start exercising as a doctor, as a nurse, at the operational level or as at the intermediate level. It's always an exception that these people start here at the central level. So by the grace of God, I was fortunate to start here in my career. So that's how the health structure is organized. Are we together? Friends, are we together? You are quiet. So regional level is not an answer. The regional level simply means that it's an administrative level. It's not a part of the health pyramid. Is it okay? I hope you understand. Are we together? All right. Okay, suivant. Great. Non, mais pas fait. Are you sure? Okay, next question. District health system. So where the district health system for here? 1 or 2 or 3? Okay, beautiful. A. True or false? Yes, that's actually true. And normally, it is said that at the district level here, between 110 kilometers and another, there should be a hospital. That is, a hospital is not supposed to be more than 10 kilometers away from where people live at the district level. Because it has been shown that when a hospital is more than 10 kilometers away, people do not come to the hospital. Because of the economic status and the accessibility of the road network. Is that okay? So the population there is just a characteristic of this district. Number 2 will be
between 500 to 15,000 square kilometers.
yes, it's not coming here. 10 to 15,000 can be one. The interval is this one is the median. They can go as far as 5 to 15, but the average is this one. Is it okay? Yes.
Clearly defined administrative and geographical area.
True or false? Yes.
President of the management committee of the health area.
That's the wrong answer. That's the name of a person. That is a position. not a characteristics of a district health area, because the question is testing your understanding of how a district health area is supposed to be scheduled. Is it okay? How many district health area in Cameroon? Who knows? Who knows? 4? Goodness. You know, I heard the district health area is. They're over 100. You said 4. Very did. How many district areas do you have in Cameroon? Or where do you know? Where are you from? Hey, what's your name? Which is it? More program. As a children. Do you know me? I've seen you before. Do you know the name of the book? So, let me check something. I want to give you information. I think you'll find. So Cameroon has a total of 210 district health areas. They are partitioned as such. I will just send this to Mr. Penn. I think people have WhatsApp, right? Okay, we'll share this with you right here. So that you might see even where you are coming from and the number of district areas that are found specific. So I'll send this document to him. I'll send it to you. Mr. Penn. Mr. Penn. You say your code Ilan? Ilan. Okay. So if someone has an iPhone, I can airdrop it to you. You may just call me and airdrop it. So you share with them. Okay, it's not me. Just read. How does physical exercise promote health? You know, exercise is an alleviating factor for many cardiometabolic diseases, right? So how many of you do sport regularly? If you did sport, if you did an exercise for the past 7 days, what do you do? Past 4 days, past 3 days. An exercise is an exercise. Walking, trekking is an exercise. Dancing is an exercise. Yes. Exercise is defined as any activity that causes you to consume energy more than the basal metabolic rate. Because we know that the basal metabolic rate refers to the amount of energy you consume when you are at rest, doing nothing. This energy is simply consumed for the purpose of maintaining you alive. So any other thing that can cause an increase in the consumption of energy is an exercise. But now, you should know, a rigorous exercise is not the same as a light exercise. That's to say that someone who runs from here to the roof, you don't consume the same amount of energy as someone who treks from here to the roof. And you translate your health differently. Cardiovascular diseases, because most of you are seated. Let me shock, do you know that sitting is dangerous than smoking? Did you know that? Yes. The chair is dangerous than a cigarette. Because 24 hours in a day, you sleep for at least 18 hours. For example, last night you were sleeping on the bed. This morning, you sat at the dining to have breakfast. You sat in the restroom to relieve yourself. You sat on a bike to get here. You are going to sit, you are lying on the bed manipulating your phone. So it's a dangerous something. That's why in a country like US or Rwanda, when I went to Rwanda for an academic exercise. So the way they are designing offices now, people work in the office while standing up. Or even if you are sitting down, there is something like a pedal, a bicycle pedal. If you are sitting there, unless you're walking. So you are sitting on the computer, maybe in the office while working, but your legs down, they are constantly in motion to reduce the onset of metabolic diseases. Because sedentary lifestyle, as they report, is a risk factor for many diseases, cardiovascular disease, obesity, and whatnot, cancers. So please, you should change the way you look at things. You don't trek or walk when you don't have transport. Trek intentionally. Run around intentionally. Is it okay? Because even those of you, when you go to the gym, you just snap pictures. You don't even actually just exercise. You snap pictures to be posting that I love the one and the comment. Okay. Continue the question, Mr. Man.
Hey, constricting the lung.
True or false? What did you say in the beginning?
This guy is self promoted by hey, constricting the lung.
Is it true? Read the other, explore the other ones. B.
Regulating heart rate.
True or false? That's so straightforward, right? Read the other ones.
C. Preventing digestion. And this is only A and B are correct.
So what's the answer now? B is so correct. Great. Because I said exercise has an important effect on the heart. When you see people who are exercising, you know. Please, and as you exercise, you should reduce your dietary intake as well. Because most often on Sundays, you see people they go for sports. You know, they sport, they sit, they eat throughout the day. Now, cancel the sport that you did, please. If you do that. You have a big of bouillon, pepper soup. They eat and drink throughout. Then at the end of the day, you have a protruding stomach. So, let me tell you something. For any disease that you ever have in your life, there are two components. You have a genetic component, that is where you are coming from, your family, and you have the environmental component. This environmental component accounts for 90% of diseases. This one accounts for less than 10%. So it means that in any disease you have, the genes of your body contribute just less than 10%. It is mostly linked to what you do. And what you do entails where you live, the kind of food you eat, the kind of lifestyle you have, the kind of how you use your mobile phones, and everything constitute the environment. For example, many of you here, if food is not so sweet, it's not nice to you. Food is sweet when you have packed it, you added actually much broth. It ought not to be so. Food is nice when it has so much fat or oil. It ought not to be so. Is it okay? Because prevention is the simplest thing you can ever do to have a good health, but most often you neglect it and focus on treatment. Next question.
Refuse, please.
What's the refuse? Yeah.
Waste from the skin.
Is that how we call it? It's wrong, right? B.
Don't get plants and animals mixed with water.
Is that what the refuse is?
Household equipment. Household or industrial waste.
Yeah, household or industrial waste are referred to as refuse, and they are classified, which we will not really go into that now. Next question, you read. We are reading now.
You draw.
Incubation period is known as the period which an infectious germ enters the body. The period period in which a poisonous substance is injected into the nose. C. The interval between exposure to an infectious agent and the appearance of the first symptoms. D. A transparent container for keeping premature babies for a period of time.
Wow. What's the answer? So, okay, you begin with A and you tell me whether it is true. You explain what each of them means. What does A say?
An infectious gene enter the host.
How do you call that period? The question was sense. It's not the question of sense, Mr. They are clocked at the time. Question number how many? 15. Okay. So what does A say? Good. How do you call that period? Sorry. No. In the natural progression of a disease, as we saw in epidemiology, that's not how they call it. They are standard terms.
Yes.
Sorry. Prodromal. That's the prodromal period. The period which an organism enters. You haven't heard the science yet. Prodromal can be characterized by sub-limited signs that are not visible clinically. We call it the prodromal period. Is it okay? You have the prodromal period. B.
The period in which a poisonous substance is injected into the host.
No. According to the natural history of a disease, you don't have the period of injection of a poisonous substance as one of the points. You don't have it. You have a period when the infectious organs of the agent enters the body. That is, you don't have signs yet. You have a period when the signs can be detected by some laboratory tests, but when they are not visible. You have the period when they are visible and can be characterized in the hospital. Then you have the end stage when they try to manage disability and maybe accompany the patient to that palliative care in the normal history of a disease. You have seen it, right? The progression of a disease in epidemiology. Have you seen that? The natural history of a disease. Have you seen that? True or false? You haven't? Yes. Sorry. Yeah. What did you say? What is that? Okay, all right. What is the difference in terms of characteristics, right, between the prodromal phase and the incubation period?
Incubation is when the infectious agent is entered. Like the period between entry and the manifestation of the signs.
Yeah, it's called the incubation period. Yes. So what about the prodromal?
The prodromal is when the patient starts feeling sick. Like the signs are manifested.
Oh, really? Okay, read the other options. Read C.
The interval between exposure to an infectious agent and the appearance of the first
So what do they call that? Incubation. So finally now I seem not to get what your word is. Maybe you could explain further to me. I'm listening. I still must be getting you very well. Please just.
The proposal is set as prodromal. That is the period which an infectious germ enters the body.
Yes.
Then I think the prodromal phase comes after incubation, which incubation is
So between prodromal and the incubation, which one comes first according to you? Because the prodromal period is characterized by signs and symptoms that are not specific. During the prodromal period, you may experience signs and symptoms that will not really tell you if this disease is this one, because you may experience things that are common to various diseases. But in incubation period now, which refers to the period between the entry to the manifestation of the first sign that can be linked to the disease. I don't know if you get it. So the difference is that during the prodromal, the signs and symptoms are non-specific. But incubation, at the end of the incubation, according to the timeline in disease situation, you may have some symptoms that can tell us that it is likely the situation. You get it? Yeah, so it was just a matter of terminology. And to tell you again, in some textbooks, in some epidemiology writings, when they are talking about a natural period of disease, you may not even see the prodromal period at times, except you are really into clinical medicine like laboratory medicine. In a typical course of a disease, you will just start with the incubation period. I think that's why we need to not get it here, because the signs and symptoms are not specifically prodromal, so it might not really be compared to us at times characterizing the disease, except we have molecular tools that are highly specific to the disease. Get it? Yeah.
Patient 16. Which of the following is a focal disease? A. Hypertension. B. Diabetes. C. Typhoid. C. And hepatitis B.
So what's the answer?
Typhoid.
Why is it typhoid? Why is hepatitis B wrong?
Hepatitis B is more person to person.
Person to person. Two, how many routes? There are how many major routes of transmission of disease? The first question I answered, I think it's still on the board. It's on the board. The vertical route and the horizontal route, right? What is horizontal route? You are not at the beginning. Where were you late? Okay. Okay. I can get the question. Read it, please.
Which of the following is a fatal oral disease?
Yeah.
A. Hypertension.
Is hypertension, first of all, a transmissible disease? Okay, you know disease can be classified based on whether you can get it if you are living in close proximity to someone who has it, right? We call them communicable diseases. What are examples of communicable diseases? Sorry? TB, beautiful. Another example from that role, example of communicable diseases. Common cold, flu, yes? What again? Typhoid. Yes. Cholera. Yes. Dysentery. Yes. Then on the other hand, you have diseases that are called non-communicable. That is to say, if someone is sick of the disease, by the fact that you live by them, you cannot have it, right? You cannot get contaminated. Example: diabetes, hypertension. What? Are you curious? What are you doing? You want to listen at home?
It was a random answer.
It was a random answer. No, this answer is not correct. Epilepsy. I I know many of you are afraid of epileptic patients. It's not communicable. Is it okay? Good. So this question is testing orofecal. So hepatitis B, you can easily have it through maybe mother to child or horizontal, but rarely orofecal infection. What does the other option say? Diabetes is sort of non-communicable, it's out of place. Hepatitis A. So what is the answer? Yes. Hepatitis A can be transmitted. No. Is it there? Okay. Good. Typhoid by Salmonella typhi, right? Yeah, you usually have some typhoid that live birds. Avian typhoid in chicken. Non-Salmonella typhoid. So you have it in birds. It's very common, especially in people who are working in poultry farms. The birds always have it a lot, and it's a public health concern because this disease actually destroys birds a lot. And know how important they are to us economically. So another thing you should know. Okay, next question.
Question 17. One good source of water fit for consumption even without sterilization is.
What's the name of this? Do you understand the difference between prodromal symptoms and incubation period? Prodromal incubation.
So he said that prodromal is when you are experiencing the signs and symptoms, but it doesn't.
Is that what I say? That's what I'm asking you again. What did I say? Not quite still. Non-specific signs and symptoms. Non-specific. For example, fatigue and malaise. If someone is having fatigue and malaise, what are we linking to? Are we linking to any disease? No. So prodromal period is always characterized by the occurrence of non-specific. Now, when you talk about the period when a specific sign or a symptom can be attributed to a disease, that is at the end stage of the incubation period. I was coming to that because you are just accepting because no one's required.
Yes, sir, and this explanation again from what you said, and it is not understandable. Because in prodromal, it's like there are non-specific signs and symptoms.
Yes.
Then now the incubation is the entry of the disease to the manifestation
Of the first signs and symptoms of that disease.
Means incubation should come before prodromal.
Sir,
Yes.
for medical lab, the way they explain this is,
Yes.
we always have after the entry, we have the incubation period. Before then now, we can talk about prodromal period where this sign I'm really non-specific.
Non-specific, which is what I just said.
Yes, sir. So now my question is, before prodromal and prodromal period and incubation period, which comes first?
Incubation, inters. Incubation means you are entering into the body. It's always at the first, it's at the beginning of the progression of the disease. Incubate means enter.
That's now.
No, incubation means entry. Is it okay? I don't know if you understand now, Laura. Okay. So I was coming to because I knew that you did not understand. You just was, I wanted to come back to like that when to make sure that you get it right. Good. Okay, all right. Next question.
One good source of water fit for consumption even without sterilization is A. Spring water, B. Rainwater, C. Well water, and D. Surface water.
So what's the answer? Spring, right? Another option, maybe you can have water from a borehole. But surface, because they're not prone to surface runoff. You know, in I don't know how they call it in French, but it's what we call the nappe phréatique. I don't know how they call it in English, because since I did medicine in French, most of them in the English words, I forget it. Actually, when you dig into the ground, there's always the first layer of water. This first layer of water, which is always not very far from the surface, it could be 10 or 20 meters away. It's always prone to contamination, because the earth we are seeing as a filter. You know that the water we are drinking is the same water from the toilets, from dead bodies that we are drinking back. Are you surprised? So the deeper the layer of the water table below, the purer it's going to be. That's why most often when you hire these people, the boring companies, when they are trying to establish a borehole in your place, you realize that at one point they need to dig through the rock. If you have witnessed that before, but if you don't know that for you to have a borehole, which always at least 100 meters by definition, you must dig through a rock to get water that is purer. Because for water to sink, go through all the filtration process and get here, it must have been pure in nature. But this first layer of water is always prone to contamination by microorganisms, by chemicals, or by whatever nature you may think of. But from borehole, it's always very pure. That's why when you can establish one, it's even advisable to consume that compared to, I don't know if there's anyone who consumes calm water, which I find very horrible. So, then the quality too of water depends on where you are having it from. If it's not a borehole. Now imagine you are living on an inclined island. You build on an inclined, landscape. You build your house here, then you dig your well here. There's another piece of land just up here. Somebody buys it tomorrow. So will you prevent them from digging their toilet? So where is the toilet ending up in the water you are drinking? If it's not a borehole. And many people experience that in Yaoundé. So there is actually a factory, there's an industry in China. I saw a documentary, that was a couple of days ago, where they collect all the sewage water like in Yaoundé, they collect it, they channel it, they take it to the industry, then
They do send the US.
Yeah, Boston.
no, I'm saying because in the documentary I watched, they don't want to waste, so when they can in other words, these vehicles that come and drain your toilets, right? When they drain, they take it to the industry. They purify it, it's water that comes out, people are buying and drinking. No, it's pure. It's better than what we drink here. It's just that you know that it's from a toilet. What if you don't know? Sorry. For gas. No! Biogas is another use. The uses are so many. You can see from the bottom of water. Like what is being done in China?
What I saw, when they do that, they extract the remaining solid matter they used to represent the gas. And then the water they keep on board, they define it as any substance.
Yes, even the solid matter can be used in the production of fertilizer, a lot of things. Yes. It's not that you okay if you're opposing the farmland where you harvest maize and eat. How sure are they don't bury someone in the past? Maize is different. So you are eating somebody. Okay, next. Laura, you see the one reading.
The term modus refers to illness.
It has to last longer.
Personal hygiene in reproductive
The option?
There are options.
fitness is the 18. The term modus refers to A. Fitness, B. Dizziness, C. Tiredness, and D. Non-scoring.
What's the answer? None is correct. So what is morbus? Who else needs this question? That's not fine. Yeah, I'm listening. Morbus means disease or sickness in Latin. Yes. The Latin word for disease. That's why I say morbid mortality. You hear the word morbid mortality, right? From the word morbus. In epidemiology, we always say in French, morbid mortality. Morbidity, that's the same thing. So morbus in Latin means sickness or disease. Is it okay? Alright. Suivant.
Personal hygiene includes the following except sleep, changing of dresses,
Okay. Let's analyze the options. This is sleep. Personal hygiene except. So they're asking the wrong answer, right? Is sleeping a part of hygiene? Does it constitute part of personal hygiene? Okay. Option B. Frequent bathing, right? Boys bathing every day. C. This concerns us, the boys. Change your otherwise every day. It's part of personal hygiene. Then the last, hand washing it is. Who can demonstrate to us how a simple hand washing is practiced? Who can demonstrate to us how a simple hand washing is performed? You are taught this, right? Yes, okay. Advanced practice. Okay, so the okay, Laura, let's see. We'll be explaining what are the steps. How did you go there? Nobody worked on hand washing here. We are HND. We work on maybe personal travail activity. Next, you are already now. Swing C next.
Number one, discuss of the following. Home management.
Home management. We discuss it. We start how you must. First question, is it not called causes and predisposing factors or possible infection? Is that another picture? Which means I don't have it. And someone needs to be someone was a drop. Please yes, sent to man. No, brother sent to you see Dr Mbinyui. Sent to have you sent? I haven't received this. It's a net. Okay. Okay, let's proceed. Co-management meant. Okay, that's why in Cameroon, the system we use, your bills, the state will be like, okay, I'm going to pay a part that is linking toward the Divergent model, and you are going to pay a part. That's a part of the Bismarckian model. So according to the health sector of Cameroon, we use the two of this model. But just a few countries in the world have succeeded to establish the Divergent model. That was in Russia, during the time Russia had the Third Economy. I mean, most of the things like vaccines, subsidizing of healthcare, and it is mostly done for people with chronic diseases. The state can say that, okay, since you cannot pay, maybe they want to handle a disease like HIV. The government is the one who buys all those drugs. Are they the ones who buy them? They're not the one. Hepatitis B. People are saying it. It's crazy. If you find that, you have to denounce it. With the last drop of blood we are taking. The government says, okay, now I will give you mosquito nets. You always buy mosquito nets, they keep the share. The government is paying billions for that. Where I work, we're the ones who order HIV drugs. We are the ones who order. We command for labs in China, in India for billions of francs. They come to the country, they give. This is like hepatitis B. Maybe the government has asked that, okay, since I'll not pay for everything, you buy a syringe. Make it happen if you need to give an injection. Or since this bed where you are hospitalized ought to have been 10,000 francs normally per day, you're going to pay 2,000. I'm going to pay 8,000. So it's what we call a mixed model. So co-financing means the sharing of financial responsibility between two or more parties to manage a health project. Is it okay? We are called co-financing. We share the financial responsibility. So just as we saw in co-management, what do you think is the objective or the advantages and the disadvantages of co-financing? So probably I don't know about the fact that the government is doing a lot of things for you for free of charge. Even malaria in children, I don't know that. Hepatitis B, tuberculosis, HIV, you don't know that. What do you know, please? Yes. Sharing of financial responsibility for a project or a service, in this case, say for a health project or a health service, by 2 or more parties. And in healthcare, this contributes to, the contributors may include those who share. You now have the government, beautiful Plan International, Helen Keller Foundation, like I said, I was talking about vitamin A. Many of them, the Gates and Melinda Foundation, that people hate a lot, but I love. Private organizations, those are the various contributors. The communities. For example, there is a microscope in the health center in my place that I bought. I gave to the health center as a gift. My name is there. So now, if you don't have to do a test, if the test was supposed to be 1,500 francs, you can keep it for 1,300. 1,400. We have borne a part of the burden. So the purpose of co-financing is to mobilize resources. The objectives are resource mobilization, reduction of financial burden on one party. For example, if you pay for whatever you are doing, all of us know about, you know about USA, right? Those are the major donors. The purpose is reduction of financial burden on one person, adequate resource mobilization, and improve sustainability of health programs. And tomorrow, I encourage you, if you have the means, do something for your community. Are you getting it? You must not have all the money in the world you can help. You will never have all the money that you want. You know that? All the money that you want in your life is not going to end in your head. Because even if you want 1 billion francs, and when you have 1 billion francs, you will need 2 billion. So you can do something for the community. Where you are from, you can choose a day, go to the hospital and do volunteerism. It's not always about money. What are the advantages of co-financing? Growth, increased availability of funds. Funds are readily available. And it improves sustainability. Now you tell me the disadvantages. Anything that has an advantage should have what? A disadvantage, right? Are we together? Good. So, what are the disadvantages of co-financing? Conflict. That's been due to how conflict arise. The issue is that most of these big donors that give us gifts, right, like the white, they always have a hidden agenda behind it. Like Kamnafol, if you know Kamnafol is an NGO. Behind, they encourage same-sex marriage. So what happens is that when they give those gifts to a country, diplomatically, they can give some conditions that okay, for you to continuously receive funds from us, you have to legalize same-sex marriage. You have to legalize, or you have to be permitting abortion. And you know abortion is illegal in Cameroon. So when they give this gifts to you, at times they give some conditions that you have to obey. So actually there is nothing that is free. It's always a way of keeping you loyal to them and be their puppet or controlling you. So the disadvantage is that it leads to financial dependence and lack of autonomy. So you cannot make some decisions on your own. For example, if you receive US aid, you cannot make some decisions about some disease alone without consulting them. So at the end of the day, they're the ones who control you. Some informal sources even say that some of the gifts are always aimed at controlling birth rates. It's true that is not verified, especially by the Bill and Gates Foundation, Melinda Gates. So whenever you see a gift, try to ask yourself that, but what is the purpose? What is hidden behind it? Because the message is not always what we are seeing. The message is always hidden behind. But as gullible as many people are when they see gifts, there are maybe microscope, laboratory things, hospital pets. Whatever you receive as a gift, know that the person giving you will receive at least 10 times more than that behind from other means. It will be gaining of access to the community, right? In most of our villages, when you go there, you see wives, right? You think they're moving a village for no good reason. I have a wife who has been in my village for more than 30 years. I don't know if you know the leaves and young. You think it's there for no good reason. They gather intelligence and they send to their country. So on these people, they discover mines where precious metals are and they exploit them without their knowledge. For example, there was a Chinese NGO from the east region of Cameroon. So what happened is that they discovered a gold mine. They don't look pretty, they got pushed out. So what they did is that they brought up a story. After every 2 months, they claim that about 2 of their personnel have died. They will make coffins for them. They will go inside and transport to China. There's a corpse that they want to go and do. They discovered it. So it helps them to fully gain access to our community and can lead to exploitation of some resources. Are you see that? I hope you are getting so that tomorrow don't be blinded by gifts. Anything that you see, there's always a reason behind. There is no free will. I hope you know that. That's why you have to work. Now, since we are so gullible, when you see a white man, maybe in your village, you are happy. You snap with him, right? If he's inside your house, you become a good friend. If you are the friend of the white family, your state is going to increase in the village. Disadvantage is that they lead to dependency on donors and lack of autonomy. It can equally lead to delay in the release of funds. What we have is something I would encourage you to do. When you have you can do a degree and do a master's in you are still young, you are still kids. Some of all of you are still kids. We have been schooling for more than 15 years after the advanced level. Let's say I see me about 3 or 4 years after advanced level. And the advanced level about 14 years ago. I've been schooling ever since then, 2012. That's 14 years. So we ever seen primary school by then. That's actually what we do. So we are the cover of the book. Very classy. Yes. Yes. Okay, you can do So you know Mr. Omba. We were the first batch of the school. We were the first batch. And the first place where we learned class from there. Sorry? What's your brother? Hey! From which company? Dauda from Daura. Oh no, he's my good friend. You call him Joe. I'm not right to Doorman of Best Memory, my chemistry teacher, Mr. Christopher. Yeah, those are Daura is my classmate. Where is he now? Yes, Allen did a PhD in sustainable development, something like that. Yes. He had a PhD already, right? Yeah. Where is his office? Okay, next question.
Next question. Outline the concept of public health. The concept of public health.
Concept of public health. Components of concept.
Components. Sorry.
Are you hungry? Okay, the components of public health, of public health. So could you pick the components? Good. I'll start with you. Components of public health. The component of public health, it has those three important aspects I've been talking about in the definition of a drug or of medicine, as she was trying to say. It's health promotion, disease prevention, treatment, what again? Epidemiology, beautiful. Environmental health, this country is part of it. Child maternal health. Health education is health promotion. Vaccination. Vaccination is not prevention. Prevention. Doing things like biostatistics, which people hate. Because we hate numerical sciences, actuarial science. I think that was called Jawara, right? Yeah, I remember. When you state any of them, you're supposed to give a brief explanation, okay? So let's begin. What is health promotion? What is health promotion? Anybody? Hello. What's health promotion? Okay. Yes. We educate people on healthy lifestyle so that people do not fall sick. Discussing as a risk, so with their younger ones and lock the house. Everybody is glued to the phone, right? So, but this is not a question about development. Like how many of you here will probably identify with your village? You will not. That's why whenever I ask your name, the first thing you tell me is your English name. Most often you are actually thinking of your village name. Very few of you. How many